Most first-time moms have an idyllic notion about breastfeeding their infants, but what seems to be so natural may not come naturally at all, at least not at first. We're here to help you adjust, step by step.
Making sure that your knees are elevated over your hips.
Before you nurse, make a habit of taking the time you need to get comfortable and organized to avoid interruption. Cushion yourself with pillows and have some water within reach.
Hi, baby girl.
Experiment with a position that works best for you and your newborn. The most popular breastfeeding position is the cradle hold.
You want to make sure that she's belly to belly.
Place a nursing pillow on your lap to elevate and support your newborn and save you from neck and back strain.
Oftentimes they do need to be readjusted by adding extra pillows so that you aren't hunching over to stay.
Use the crook of your arm to prop up baby's head facing towards your breast. The other arm is free, first to guide your breast into place, then to cradle around and beneath the infant once feeding is underway.
I'm going to try to bring his feet way back, like a legs up the wall kind of position. Okay.
With the football hold, cup baby's head in your hand and position the little one's legs beneath your arm and along your side, again on top of a pillow for support.
Tip yourself way over and tuck them way underneath your back. And if you were here by yourself, you would just take this hand, reach behind and tuck.
And then there's the side-by-side or lying down position.
So you want to bring the baby in nice and close to you. And again, lining her up, nose to nipple.
Great for those late night feedings or whenever you are weary.
What we're going to be practicing here is the prone position, or what's sometimes called the down under position, and that's because you're down under your baby. This is a very instinctual position for the baby. Chin is nice and close. Now if he opens his eyes, look at him. He's peeking right at you.
What do you do when there is more than one? If you are breastfeeding twins, it can make a world of difference if you learn to nurse both babies at once using the football hold. Alternatively, have your partner pitch in by feeding one baby a bottle of expressed milk while you're nursing the other. Now that you're in position, the next step is for baby to latch correctly onto the breast. Without a good latch, the baby can't get a sufficient feed, and the mother can end up sore, or even worse, with nipples that are cracked or blistered. You can help your newborn catch onto the latch, step by step. First, try to express a few drops of milk before you nurse to encourage letdown and interest baby. Then, allow your little one's head to tilt slightly back so baby is looking at you.
Having it in your nose nipple makes her head have to tilt back, and you want to tickle her. That's it.
Gently stroke around the mouth and cheeks to stimulate the rooting reflex.
Nice big mouth. And you can make her wait until you see a nice big mouth.
Nice big and wide.
When the mouth opens wide, nestle baby close with baby's chin firmly on the breast. With your finger, guide your nipple into the top of the mouth, above the tongue.
There you go. And he's sticking that tongue out.
That's important. The baby's tongue must go under the breast and baby's mouth over the nipple and around the darker area or areola. Finish with baby's lips flared out like fish lips around your nipple. That allows baby to suckle in a way that draws out the milk.
Perfect. Very nice. You always want to use your finger to break that seal so it doesn't cause trauma.
If at first you don't succeed, don't give up. Take a break and try again. You and baby can do it.
Nice. Go ahead.
Then, when feeding begins, make sure baby's nose is not pressed completely against your breast and that there is ample space to breathe. Remember, breastfeeding can take some getting used to for both baby and mom, so don't be shy about asking for help. There's no shortage of assistance, from nurses to your pediatrician to lactation specialists who will come right to your home. For WebMD, I'm Dr. Tanya Altman.